Hey guys, first of all, I want to warn you, if there are any males watching this video, this is your warning, you may want to turn it off now because I'm about to talk about some things that have to do with PCOS and it's probably not going to be so interesting for you, or might gross you out, I don't know. So that's your warning. If you keep watching, it's your own fault if you get grossed out or whatever, so I gave you fair warning. So anyway, as I just kind of gave it away, I am going to tell you a little bit about how my PCOS symptoms have changed since surgery. There haven't been like a lot of major dramatic changes, but there have been a few things that have changed since surgery. First of all let me give you a very brief history. It could take a very long time to tell, but first also I want to apologize about the quality of this video. I'm not orange like the last one, but the quality isn't so good because it's dark in here and I didn't bother to set the lights and everything so that it looked better because I'm in the middle of doing a lot of stuff and I just wanted to put this video out there because I had mentioned a couple of times that I was going to make it and I still haven't made it yet, so I just wanted to get it over with and put it out there now. So sorry about the quality. Anyway, so on with my brief history. So I think I started my cycle somewhere around 12 or 13. And I don't remember exactly how long I had it, but I did stop it at about halfway through 14 years old. And you know, we were concerned, and I saw a bunch of doctors, and they tried different things, different hormones and stuff like that, and they wanted to put me on birth control, and nothing helped. Nothing brought it on. No medicines brought it on. And so I actually did not have it for about 10 years, and I was diagnosed properly finally in about I can't remember right now if it was 2004 or 2005, but I knew for a long time because of all the symptoms that I had PCOS. Basically, my mom kind of diagnosed me when I was a teenager because she read an article in a medical magazine or something. It's so long ago now that I don't remember exactly what it was, but she read an article and she was like, "Oh my gosh, Kristen," she's like, "you have every symptom, you must have this." And she was right. And so, like I said, I was formally diagnosed in about 2004, 2005. I'm sorry, my eye is so itchy today. And from that point, I mean, I had that was a very proactive doctor, and he tried a couple of different things. He tried just birth control for a while, and that didn't really help. It did clear up my skin and make some of the cysts go away on my ovaries, which was great, but it didn't cause me to have my cycle. And then finally, I was also on, at the time I was on spironolactone and I was on the birth control, but those things in combination did not cause me to have my cycle. But after a while he also added metformin to that, which is generally a medication for diabetes, but in the last years they've been using it for people with PCOS. I know there's probably some of you out there who are taking metformin for your PCOS. Generally what it does is it makes you ovulate, and it also helps speed up the metabolism a little bit, and with some people it makes you lose weight, but with me that wasn't really the case. And it also helps to even out the hormones, because as most of you know who have PCOS, or maybe have a friend who has PCOS, that it makes your body overproduce insulin, so it helps regulate the insulin levels in your body. So I was on that combination for a year and had a very regular cycle for, like, I would say like 3 to 4 days every month. And then before I moved over to Germany, my doctor did a blood test and he said that I had to go off of the birth control for a little while because of the levels of my liver. I guess the fatty levels were too high or something like that, so he took me off for a while. And then I stayed on the metformin and the spironolactone for a while, but then when I came over to Germany they took me off of everything and basically proved again with several tests that I did have or do have PCOS. And the next year later, I went to my gynecologist because I was in the process of getting ready for the gastric bypass. That's what I was originally going to get. And she wasn't a big fan of the idea, and she basically said, well, I don't think you have PCOS. She did a pelvic ultrasound, and there weren't very many cysts on my ovaries because they had put me back on, after a while, they had put me back on the birth control after being here for a while. And I told them, it's not going to work by itself. I knew from past experience that it wasn't just going to work with the birth control. And they were like, oh yeah, it'll work. And it didn't. Several months taking the birth control, it didn't work. But it did make the cysts that I had on my ovaries for the majority go away. And so when I went into her office for the consultation, all I needed basically from her was a paper stating that I had PCOS. And she says, well, I don't think you have PCOS because you don't have tons and tons of cysts on your ovaries. And I said, but I have every other classic symptom of PCOS. I said, the only reason I don't have all those cysts right now is because I'm on the birth control. And she's like, yeah, well, I don't think you have it. You need to do all these tests. And I had to take an ACTH test or something like that to rule out some other thing, which I didn't have. I knew that I had PCOS all along. She just didn't want me to get the surgery. I mean, I'll be surprised if I go back to her. I may just go to her for the yearly stuff, and in the meantime try to find a new one from a friend who, has a good gynecologist. And I mean, she said some really stupid stuff. She said to me like, oh, this surgery isn't going to fix you. It's not like you have a broken leg. And I was just like, whatever. Like, who are you to tell me, that this surgery isn't going to fix me? I didn't ask for your advice about it. I told her, I very respectfully, I said to her, I don't, sorry, I'm fidgeting with my hair. I was like, I don't want your approval. I mean, if you want to give me your approval, fine. I don't need your approval. All I need from you is a letter stating that I have PCOS. And so because she didn't agree with me, she tried to rule out PCOS because she knew that that was something that they wanted to know in order to approve me for the surgery. So I was very upset, needless to say, when I left her office, and I called up my doctor and I called up the surgical team at the hospital, and they were like, well, we'll find a way around it, that you don't need to have her, proof from her that you have PCOS. And so they did. My doctor wrote me a letter and he said that, I do in fact have PCOS, and that surgeon's office also said that, in their letter to the insurance company. So that was all good and fine, and I haven't dealt with the gynecologist since then. But I did end up going to an endocrinologist in November, and he said, generally in Germany here, they don't use metformin yet as a formal treatment for PCOS. They do in certain cases, like in mine they did. Like say, yes, it's okay that you take this, but you have to sign a release. Generally they give metformin as medically necessary for people who have a child wish, like who want to have children. And I do want to have children, but not just yet. Obviously I didn't want to get pregnant before the surgery, and don't want to get pregnant for, until it's, safe for me and a baby, which will be about a year out from surgery. So in November I started taking the metformin. It wasn't covered by my insurance, but we have a great public health care system over here, and I think I probably paid about 22 or 23 for 100 days worth of medicine, which is fine by me. So I started taking that together, and for a couple of months before my surgery, I had a regular period, light, not very heavy, normal, just like it was before when I was on the combination of birth control and metformin. So with the combination, it happened again, just like I knew it would. Then I was not required to get off of my medicine prior to surgery. However, I decided, since I'd heard that so many people had done it, that I would stop taking it a few days before. So I stopped taking the metformin and the birth control and anything else I was on a few days prior to surgery, and I did not take anything while I was in the hospital.